Go ahead.
Yeah, so I've been using some of those, and I didn't know what you had just said.
Yeah.
To put it on the place which makes so much sense.
Yeah.
But I've been putting it here, and you were talking about earlier that it goes right in through the olfactory nerves. It's not as effective to just breathe it in as put it directly on the spot.
I really appreciate that question. This is something often misunderstood. Aromatherapy is a smelly stuff, and by smelling it, it does it. That is true, but it is less than half of the story. That pathway is a powerful pathway. It works really well through the olfactory system, to the limbic system, to the thalamus and the hypothalamus. And that's great. And even if we use something like the roll-on, which is for topical use, that is part of the effect. And you roll it on wherever your tension, your problem is, and you smell it more or less, and you can support that by rolling on a little bit under your nose, and then you support that pathway more. But another effect of essential oils is that they bind to receptors not only in our nose, but they bind to receptors anywhere. Different essential oils bind to different receptors in our system. There are essential oils which are particularly good for the liver. They bind on receptors in the liver. There are essential oils which tend to be excreted through the kidneys, preferably. And if you have a kidney infection, you use these, and they go through the bloodstream, goes to the kidney, they are excreted there. And because they are excreted there, they're concentrated there, and they clear out the infection there. So the direct impact on the tissue of essential oils is a very, very profound effect, which we don't want to neglect. And that effect now, that happens on the cellular molecular level, that these essential oil molecules, they have just the right size, and they have chemically the right balance between water soluble and lipid soluble. They're mainly lipid soluble, a little bit affinity to water, that they tend to go to particular receptors. Now, there is a third aspect of essential oils, and that is they have a subtle energetic aspect which is beyond any material structure. It's just the vibrational quality which is in the essential oils. You can notice that, okay, you smell an essential oil, within you get immediately, within 1-2 seconds, you know how it smells, and you like the scent or you don't like it. But there is another response, maybe 10 seconds later, which is seen in the EEG, in the electroencephalogram, which you measure with electrodes on the head. There is a delayed response, and when I see, do I like an essential oil, do I want to buy this, is the sandalwood good enough for our line? It may smell nice, but 10, 20, 30 seconds I don't feel so great about it anymore. Its vibrational quality is not as life-supporting as I would want it to be. It's a very subtle aspect of quality control. So there is a layered effect of essential oils, and the sense of smell is only one aspect to it.
Thank you.
Is there a roll-on or an essential or any other essential oils that will help with blood pressure? And if so, what's the best application?
High blood pressure or low blood pressure?
High blood pressure.
High blood pressure.
Mm-hmm.
Yeah, I mean, the first thing you always can try is lavender. Lavender is good for almost anything and everything, like meditation or Kleenex. You know, it's the universal healer, lavender. There's hardly anything what lavender is not good for. However, for many things, the effect of lavender is not very strong, very powerful. If you look at a specific effect we're looking for, specific problem like high blood pressure, there are two oils which are more powerful. Sweet marjoram and ylang ylang. Now, the surprising thing here is, in that case, they have the same effect. They're good for high blood pressure. They lower the blood pressure. But otherwise, ylang ylang is a very strong aphrodisiac, whereas sweet marjoram is an anti-aphrodisiac. So whatever the reason is for your high blood pressure, you may choose either sweet marjoram or ilang ilang, whatever it's right for you there.